Health Matters on Arizona Daily Mix is brought to you by KAZT Dental. Call KAZT Dental today for your free consultation. 602-753-3064.
Now, here's three letters that confuse just about everybody these days. C, B, and D. Huh? Confusing
Yes.
to a lot of people, Elaine?
Yes, it's very confusing.
Dr. Burns, Dr. Elaine Burns, whose official title is Director, owner and founder of DrBurns ReLeaf CBD. Let's define it right now.
So CBD stands for cannabidiol. It's one of the chemical constituents of the cannabis plant, but it's becoming very famous and widespread right now because it's the non-psychoactive or intoxicating form of the medication.
Yeah, because you see just a whole bunch of people, as soon as you said cannabis, they said, oh, well, wait a minute, she doesn't look like she's high.
Right.
Right?
It's all about getting better, not high.
Particularly when you're talking about pain problems like arthritis.
Correct.
Why does it work?
So cannabidiol, CBD, is by nature, the studies are showing that it's anti-inflammatory. So it actually can decrease the inflammatory markers that are highly present in arthritic conditions. The other thing in some of the other arthritic conditions like rheumatoid arthritis, which is an autoimmune condition, CBD is also being shown in studies to actually decrease the immune system and stop that overproduction of the ramping up of the immune system. So that's how it can help. With the products that I formulated, though, not only did I just use CBD because of a botanical background, I used two other, in our pain relief formula, two other botanicals that also help reduce inflammation. So now we have a triad of three ingredients working together synergistically to reduce inflammation safely without damaging kidneys and stomach.
Okay, safely. That means you have to be a little selective about where you get your CBD product, because to tell you the truth, I'm amazed with something that is relatively new on the market as an analgesic, and you see people with red flyer wagons going through the neighborhood, right?
Mm-hmm.
Okay, so how do we know what is the appropriate amount of CBD and the origin of CBD?
Well, those are two great questions, and those are big questions. And so they really, in working with their, physician, an expert in that field, because it's condition specific. As far as the dosing, as far as what to purchase, they need to look at has it been tested? What's the the regulation? There's no regulation around CBD products, and so with the advent of the industrial hemp bill, which made it widespread, a lot of producers are flooding the market, but there's no regulation, so it's not tested. So verify that it's tested for potency and making sure there's no contaminants in it. The third thing is sometimes there can be a higher level of THC, which is the psychoactive component of the cannabis plant, and it's illegal to be in your product that's sold as CBD only at levels greater than 0.3%. So you have to be asking. The consumer needs to really be aware and ask these questions. Test it and regulate it, and a viable source, and not on the street corner.
Okay, the THC, tetrahydrocannabinol.
Ooh, yes.
But that's what gets you high.
Correct. That's the intoxicating
That's the pleasure-inducing part of
some people.
The other kind of medical marijuana, and that's available only in those specific licensed locations.
That's correct. THC-infused products are only available in state-licensed dispensaries with a medical marijuana card. It's highly regulated. So,
all right, give me the info, though, and how it is that we can pass on the facts to our audience right now. What should they know? Where do they find you?
Well, they can find me. I'm the, from a clinician standpoint, Southwest Medical Marijuana Evaluation Centers. We see patients for treatments, and then also at the DrBurnsReLeaf.com.
That's ReLeaf, ReLeaf.com. And by the way, since we've taken care of arthritis with CBD, how about a little workout? Huh? That's up to you, Brad.